And thank you for joining SpectraCell's third Thursday of the month webinar series. My name is Heather Vorst, and I will be your host for this evening. We have a fabulous presentation for you today entitled Managing the Aging Process. Before we begin, I have a few quick announcements. All callers are placed in lecture mode to avoid interruptions during the presentation. To submit a question, please click on the Question tab. At the end of our presentation, we will address the questions submitted. The presentation is being recorded and will be available on our website at www.spectracell.com in our Clinical Education Center. The slides will also be available on the site for download. We are very pleased to welcome back our very special guest, Dr. Eva Cwynar. Dr. Cwynar is a practicing endocrinologist, metabolic medicine specialist, and internist in Beverly Hills, California. Dr. Cwynar is world-renowned for her expertise in bioidentical hormone replacement, menopause, male menopause, thyroid function, weight loss, and overcoming fatigue. She has received numerous honors and awards, including California's Doctor of the Year and Top Thyroid Doctor of Beverly Hills. Chances are you've probably seen her in one of her numerous appearances on such shows as The Doctors, Dr. Phil, Celebrity Fit Club, You Are What You Eat, and Jimmy Kimmel Live. Today, Dr. Cwynar joins us to share more wisdom from her latest book, The Fatigue Solution. Welcome back, Dr. Cwynar.
Thank you. Thank you for that wonderful introduction. So I'm very happy to do this teleconference because I have a lot of passion regarding telomeres. I think it's unbelievable research. If anybody has heard about it before, it actually won the Nobel Prize in Science several years ago. And SpectraCell is one of the only companies in the world that has it commercially available to patients. So I've been using the SpectraCell. I actually flew out to Texas before it became commercially available, and I had my own blood drawn at the SpectraCell lab in Houston. That's how excited I was when it first came out. So, but people always ask me, well, okay, you know about the telomere, you know how long it is individually. What do you do with it? And that's where hopefully I can help people in this lecture identify who should do it and how you actually deal with it going forward as far as life extension and quality of life and hormones and nutrition. So this is a very, very dear subject to my heart. So you take the average person, you know, meet my patient Joe. He's 51 years old, he exercises, he's in a high-profile job, he thinks he eats well, he has a good BMI, but his cholesterol is 210, his triglycerides are less than 100. Everything that you're doing for him is normal, right? And you just say, okay, come back in a year. But when you do his telomere, you see that his score is actually lower than the average person. Average being 50%, and his percentile is 7%. So on the outside, routine tests can kind of give you a false level of comfort, saying nothing's going to happen to you, you're healthy, whereas we know, and we're going to show later on in these slides, that telomere levels are actually very, very telling of congestive heart failure, cardiac arrest, coronary artery disease, stroke. So this is just one instance where a telomere can say, wait a minute, what's going on? And then what can we do about it? So what is a telomere? Telomeres, I say, they are the end coating of your DNA, essentially. They protect the chromosomes from damage. And so when you do not have a telomere, your chromosome is unprotected and damaged. And when you do have the telomere, your chromosomes are protected and remain intact. Telomeres are repetitive DNA sequences. They are found at the ends of all human chromosomes. They keep the DNA from fraying or entangling. And we have about 92 telomeres, so one on each chromosome end. And what SpectraCell does is it measures the length and integrity of those telomeres. Okay, so every time a cell divides, telomere length decreases. And when it gets to a certain length, those cells can no longer divide, and then the cell dies. And if you have enough cells dying, then the human being dies. So they are a molecular clock. The exceptions that do not have telomeres are stem cells, germ cells, and cancer cells. Clinical findings linked to shortened telomeres, well, habits, lifestyle, and genetics. So if you're a smoker, if you're overweight, if you don't have the right nutrients, if you're not sleeping well, if you go through menopause, that ages the telomere. If you're hypogonad, that elevates the poor progression. Lack of growth hormone. So a lot of people are saying, well, what's the big deal to measure growth hormone? You're growth hormone deficient. You know, we never replaced it before, but there are strong studies suggesting that shortened telomeres go along with low growth hormone. Increased homocysteine, diabetes, insulin resistance, and lastly, oxidative stresses. Things that can preserve the telomere, exercise, except that some studies have shown that if you exercise too much, you can actually shorten your telomere, which I think is just fascinating because we always think more is better, but with cardiac aerobic exercise, it can actually hurt you. Bioidentical hormone replacement. So with women who have hormone replacement therapy, and it's not just bioidentical, it can be chemical as well. I just favor bioidenticals, but the studies were actually done in pharmaceutical hormone replacement therapy where it preserved the length of the telomere. Good sleep, and again, everybody needs different amounts of sleep, but certainly a minimum of 6 hours is necessary for telomere preservation. A unprocessed food diet, good antioxidant status, and then supplements like resveratrol and caloric restriction. One thing I do want to note, and I know this isn't a growth hormone lecture, but somebody who's on growth hormone should not be on resveratrol because resveratrol can actually block that growth hormone. So it's either one or the other. If you're working on telomere preservation, you're either going to be on growth hormone or resveratrol, but not both. You can be on growth hormone and other forms of antioxidants, but not resveratrol. Okay. Caloric restriction preserves telomeres. Most oxidative stress is from normal metabolic processes like digestion and cellular repair. And they've done many, many caloric restriction studies with telomeres. And once again, rodents increase their lifespan by 35% on restricted diets. And that extrapolates into other species like monkeys and humans. So leukocyte DNA predicts vascular aging. In humans with and without vascular disease, blood leukocyte telomeres predicts vascular telomere length. And shortened telomeres are an independent risk factor for coronary vascular disease. So the shorter your telomere, the more risk you are of heart disease. But it just doesn't stop there. It can be linked to cancer. It can be linked to obesity. It's linked with type 2 diabetes, osteoarthritis, periodontitis, dementia, Parkinson's, cataract, depression, infertility. So there's many, many uses or reasons that one needs or should check your DNA telomere. And a lot of things can be changed in a person for aging. You know, strengthening their immune function, optimizing their methylation metabolism, limit the inflammatory processes, improve mitochondrial function, reduce chronic stress, and that's both physical and emotional stress, and regulation of glycemic control and insulin function, which is becoming an epidemic in the United States. And lastly, correcting nutritional deficiencies. So a good telomere score kind of gives patients the benefit of knowing that what they're doing is working in their lives. So keep doing what you're doing. Your telomere is great. If you have a poor telomere score, then you really have to jolt the person into questioning what their lifestyle is. And it's the impetus to make serious changing. And it's also a great way to show them what's going on internally before they actually become symptomatic. So internal aging before external disease. And it forces people to take a closer look at lifestyle. A lot of us kind of do what we do and we stop when we get ill, and this is a way to say, hey, you know what, you have not been living a good lifestyle so far, and you have to get your act together with it. So we look further into the diagnostics. There are people who say they exercise well and they eat well, and that's where you have to take the next step and do subclinical nutritional studies, and that includes the intracellular vitamin analysis that SpectraCell has to offer, antioxidant inflammatory status, also a test that SpectraCell has, checking for food sensitivities, which can cause that inflammation that we mentioned on the other side. And my biggest role with this is when I have a newly menopausal woman and she's uncertain whether or not she wants to start hormone replacement therapy because she's not symptomatic. She doesn't have a hot flashes, she doesn't have the night sweats, she hasn't put on any weight. What's the reason to? And start them on hormone replacement therapy. And this is a magnificent way of showing them in black and white whether or not they are aging well or not. So I use this every time in those cases, and it makes people feel more comfortable with their decisions whether or not I'm going on hormones or not. So food allergy testing, the hormone testing I just mentioned, gut function and flora. A lot of people have diseases in their GI system, and that is going to make for a shorter DNA telomere. So again, we have to investigate that, and omega-3 indexes. It's not good enough to just take a fish oil in the morning. You really have to measure the various percentages of DHA, EPA, amongst other of the omega indexes. And then lastly, correct those nutritional deficiencies by that SpectraCell. Some of the nutrients that are linked to shorter telomeres are the deficiencies of this slide. Vitamin C, which is an antioxidant, vitamin D, which is not, calcium, which is not. So it's not just about the antioxidants creating a shortened telomere. It's also about things like zinc and copper and magnesium. And that, when I first studied this, was really surprising to me. Why are these important? Magnesium regulates chromosome separation in cell replication. It induces the lack of magnesium, induces the deficiencies, shortens telomeres in rat livers. Zinc is a cofactor for DNA repair enzymes. It also regulates that inflammation. Both manganese and copper are cofactors for superoxidase dismutase, which is a powerful antioxidant. And again, without superoxide dismutase, you have a lower telomerase activity. And we didn't go over what telomerase is, but telomerase is the enzyme that protects the telomere. 20 to 25% of our population actually have this enzyme and can regrow their telomere. And there's some interesting patients that I'll be talking about in the future about their telomerase. There is also several companies that have telomerase infusions, which there's too little research for me to be comfortable about referring my patients to. Plus, the infusion runs about $20,000 to $25,000 per infusion for telomerase. Calcium is a cofactor to prevent DNA replication errors, because remember, every time that DNA has to replicate, it can be misread and misfired, so that can lead to a cancer type situation. Selenium, or the proteins that are associated with it, are attached to the amino acids, so we need those for replication. Cysteine, stem cell treatment with N-acetylcysteine corrects the DNA damage in telomeres. So another word is NAC. If people have been hearing about NAC recently, that's the N-acetylcysteine. Glutathione as well, and I do give my patients N-acetylcysteine when they have glutathione deficiencies. So all of these are very, very important for the integration of telomeres and their support of DNA. Again, vitamin E enhances DNA repair. It removes damaged DNA. And it's shown to restore telomere length in human cells in vitro. Vitamin C protects the DNA from oxidation. It slows telomere shortening in human skin cells in vivo. So again, these things not only make you live longer, but they keep you more beautiful. And then vitamin D, higher levels are linked to longer leukocyte telomeres. Leukocyte being the white blood cells. Folate, folic acid, it also influences the telomere length by DNA methylation. Telomere length of peripheral blood mononuclear cells are associated with folate status in men. And then you get into your B vitamins, which just overall help with mitochondria. And they show the reduction of free radicals in mitochondria. Okay, so the person comes into you and they're healthy, they've got decent cholesterol, they're lean, they eat healthy, but what we find is that people that have multiple deficiencies with no previous supplementation, that's 38% of our population. But it's interesting that people that do supplement will still have a very, very high deficiency rate. So they're taking supplementation, and sometimes their deficiencies are higher. Whether or not that's because they think they can eat less well because they're taking something, you know, we don't know. But just to say, oh, I take a vitamin, I'm fine, we find that you really need to be tested. And that test will show 43% of those people will have some kind of nutritional deficiency. Only 19% of society shows no deficiency. So, and this test was done on 5,000 patients, healthy population patients. So most of us are walking around with some kind of deficiency. Many things affect nutritional status. Again, we mentioned some of this. Gender as well will change the DNA, socioeconomics, ethnicity, pregnancy, exercise, tobacco, alcohol, age, lifestyle factors. So it's not just lifestyle, it's also family background. So again, I have some patients that eat well, don't have deficiencies, although that's rare. Most everybody that I test with a bad telomere does have nutritional deficiencies, but sometimes it's just the luck of the DNA. It's family inheritance. So how do we look at a telomere? So we get a report back, and it's pretty simple, and patients like looking at this as well. Patients will get a copy. I show them at the top of the line that where you see the number 10, that's pretty much where we're born. Some people are born with a little bit more telomeres, some people are born with a little bit less. But as we age, that level tends to decline, and that black line is the average length of where a person is by a certain age group. So you can measure 20, 40, 60, 80, and then obviously at 100. So you get a report of your absolute length, and then you say, how do I interpret that? And we really do it by patient age and population. So in this particular graph, this individual had a score of 6.85. They were around 50 years old, and for their age group, they're at the 74th percent of population. So that means they will outlive their counterpart by age by 24%. which is a good telomere. Again, 48 years old, you pop it up, and that's how you would extrapolate it over. So biological age, this person is 48 years old, you draw a graph over, and they're really like a 37-year-old. I actually do it a little bit differently. I would say that if it's a man doing this and the average rate of death in a man is 74, this person will probably live till 84 without doing anything. Our goal is to get that vertical blue line all the way to the right so that it stabilizes and it doesn't drop, because again, death occurs when you have no more telomere to protect that DNA, and that's when you hear about people dying of old age, or again, this is related to coronary artery disease and stroke, so of a heart attack as well, not just old age. Again, we went through that. This person, chronological age, is 48 years old, but yet their biological age would be 55. So this person would die prior to that average age of 74. Maybe this person would die in their late 60s if they did not do anything to promote wellness. Okay. Case review. Let me just go back to the case review study. I had a patient 2 years ago that, actually I first started seeing him about 4 years ago, and 4 years ago when we did his telomere, he had a fantastic telomere. His percentage was in the 80th percentile. And he is a musician, and he went on tour, left for a year, came back, still felt fantastic, did his bloods, everything was normal. But I decided to do another telomere, and his telomere went from in the 80th percentile to in the 30th percentile in 1 year. And it was shocking. I kept repeating it, and yet it still came out at 30. And he was one of the first people that I did the telomere on. So I knew that that first telomere of 80% was not wrong, because at that time we had done, the double-blind studies on him. So I send him to specialist after specialist. Nobody could find anything. CAT scans, chest x-rays, MRIs, didn't know what was going on. Finally, I got a PET scan on him. We got his insurance to cover it miraculously. And it turned out that this person had a non-Hodgkin's lymphoma retroperitoneal. And I would never have pursued this case because he was fine. He was like that case at the beginning, healthy man, not a big deal. But again, this is a way that I can follow health. Is something going on? And instead of getting a total body scan every year on somebody, I think that this is a brilliant way to discover early onset disease. And again, even when we did scan him, we could not find that. It wasn't until after we did the PET scan. Another case that I want to present here is a woman who was 50 years old that had a 50 percentile in her DNA, in her telomere, but she really wanted to bump up her values. She was older than her husband. She wanted to live life as long as he is, and so she really wanted to reverse the aging process. And on her, we did put her on estrogen with progesterone. I also put her on a little bit of testosterone because we have found that for women who are menopausal, it slows down their telomere as well. So I put them on some bioidentical testosterone. And I did all the SpectraCell testing and the allergy testing, and she was one of those 25% of the population that regrew her telomere. So after 1 year of therapy, she went from a 50th percentile to a 75th percentile, and she actually elongated her telomere. Now that, for my practice, is rare. Usually I can get a patient to stabilize their telomere. So if their length is at 6, in 4 years their length is still at 6, so their percentage of relative to society goes up, and they do have life extension. But for this woman, it was pretty miraculous that she went up by such a significant amount, and she felt great during that year as well. So we managed to achieve two things, one being that she felt better, and the other one is she was going to live longer. So it was pretty interesting. One last person that I want to just speak to briefly is an elderly woman who was quite wealthy, and she did the test because she wanted to know if she could blow all her money if she was going to die in the next few years versus needing to live a little bit more modestly because she wanted to give her grandson her inheritance. And she was actually somebody who had a pain pump installed. She had multiple cervical and thoracic injuries, multiple surgeries. Probably, you know, she'd get 4 surgeries in the past year. But that happened for the last 5 years. So she had probably 20 surgeries or so going on. And interestingly enough, her DNA was in the 90th percentile, despite the fact that she was in her 60s. So she just had to scale back a little bit on her trips and on her jewelry, and she put it away for her grandson. And when you look at her history, though, her parents lived till they were 100 as well. So although she was a sickly woman, she had really great telomeres, and that was before we even did anything with her. So just another way to look at why you should be doing telomeres on people. They all have different reasons. So once you get this, how often should you do it? I like doing it yearly. The blood is very little. You only need 2 milliliters of whole blood at room temperature. There's no special processing of it. And the turnaround time is in a week. So now I'd like to open for any questions that anybody might have.
Absolutely. Thank you, Dr. Cwynar. That was, once again, fabulous. And we did get just a ton of questions, so we will jump into those right away. Several of the questions, I know early on in your presentation you touched about athletes and especially sort of the more aggressive training can really affect your telomere length. Can you expand on that a bit?
Well, they're finding that more than 20 minutes of hardcore exercise can damage, you know, can actually shorten the lifespan. So we really encourage, and I'm talking about cardio. I'm not talking about an overall exercise program, but there are several studies that we can supply to your audience, my audience, that if they're interested in those studies. But it should not be more than 20 minutes a day.
Okay, fantastic. And there are several different supplements that are on the market that are being sold that they can regrow the telomeres. Do you recommend any of these supplements? Do you have any thoughts? Have you had any experience with using them?
Supplements per se for that prolong the telomerase, to regrow them, I'm a little bit cautious with, because remember, if you have the end portion of the telomere, if you stimulate it and it has a cancer gene on it, you can actually promote cancer. I think that not enough research has validated to do that. Like I said, there is an infusion that you can get for $20,000 to $25,000. I recommend, I have a few very old patients that they've got telomere scores below 20. Those are the only people that I recommend, you know what, this is not good. We need to regrow them. And we've got to regrow them fast. And that's where I would say, okay, you know, you've got nothing to lose then by doing the over-the-counter one. But really, if you've got the money and you've got such a low length of it, I would do a telomerase infusion rather than just doing the supplements. But at a younger age, I think that the goal is really the preservation of what we have rather than the regrowth of what we can get.
Great. And there were also several questions about using calorie restriction to reduce the telomere shortening. and various other ways of using calorie restriction as part of your plan for addressing telomere issues. Can you expand on that a bit? Or
well, it's twofold. I mean, there's separate studies that show pure calories. So somebody that is a woman, for instance, should be on 1,200 calories or less. A man, depending on body type and height, anywhere from 1,600 to 1,800 calories. But it goes beyond that, because normally when we calorie restrict, we also carbohydrate restrict. And there's a lot to be said about carbohydrate and insulin intolerance, or insulin resistance, I should say, glucose intolerance, and that plays a heavy role in the destruction of the telomere.
Okay. And thank you. There are some questions regarding vitamin E family, and how does vitamin E play a protective role with telomeres?
It's more just, I mean, vitamin E as an antioxidant. If we go back to that prior slide that we showed, all those antioxidants had a specific role, whether it be on the mitochondria, whether or not it be on dismutase, whether it not be on the angle of the DNA. So it becomes very biochemical, but vitamin E is one of the key factors in preserving the telomere.
Wonderful. And for natural intake of vitamin E, what are some of the best food groups?
You know, honestly, because I think that there can be an overdose of vitamin E, I typically tell my patients to, you know, have their fish, because that's a great source of it. But I also ask them to do a 400 milligram of vitamin E. I figure by their daily diet with vitamin E, they're not going to become toxic. Because remember, you don't want to do more than 800 milligrams in a particular day, because there's also some research that suggests more than 800 milligrams can actually hurt the heart. So you want to stabilize the telomere, but you don't want to promote any coronary artery disease. So there are studies that show that greater than 800 milligrams. So I think that if we just try to get it from diet, some people can actually overdose with foods on vitamin E. Because remember, it's a fat-soluble vitamin, so it stays in your system a long time.
Wonderful. And I also had a couple of questions about going into the intracellular, the spectrum, so the vitamin analysis. If you can just expand on why you would want to use an intracellular type vitamin analysis.
Well, I think that's key. I think, again, when we talk about why is the telomere low, or what can I do to maximize it, nutrition, I have so many people who think that they're eating clean and they're eating healthy, and they are, but for whatever reason, whether or not it's genetics that can't absorb it, whether or not it's because they have something going on in their gut, whether or not they're not eating good quality foods, there's a specific test that we can do to tell you exactly how much you're lacking, exactly how much you need. I use this test primarily as well in my patients that don't eat red meat. I think that we're so locked in and afraid of red meat and the hormones that go along with it and the bad grains that the cows eat, that we are lacking a lot of vitamins, specifically the vitamin Bs that we get. And I see it time after time again in those patients, and they'll have pantothenic deficiencies and they'll have thiamine deficiencies. B12 is huge. So that's important, not just for energy and health and mood and weight loss, but also it's important for the telomere. So the SpectraCell goes beyond just regrowing or stabilizing the telomere. It speaks to everybody who wants a better quality of life.
Great. And also, can you explain the interaction of resveratrol with telomere length?
Resveratrol, resveratrol on its own will grow the telomere. And growth hormone will grow, or stabilize the telomere, I should say, not grow the telomere, but it will stabilize the telomere. Both of them together will also grow or stabilize the telomere. But the reason you don't want to take them both together is that the resveratrol blocks the action of the growth hormone. And so when you're taking growth hormone, the expense of it, the nuisance of it, you want to potentiate what growth hormone does to your body, and you're blocking that activity by the resveratrol.
Great. And then there's just several questions kind of generalized about recommending the best raw foods where you can find the nutrients that you're deficient in, selecting good supplements, determining high-grade supplements that you can use. Do you have general guidelines for patients?
Yeah.
Physicians?
I mean, that's a seminar in itself. But let me just, I'm assuming that most of the listeners know what the SpectraCell is, but for those who don't, I just want to go into it a little bit. The SpectraCell intracellular vitamin analysis is a test that's done on white blood cells as opposed to serum or a red blood cell. And it gives us the average of usually 6 to 9 months worth of nutritional balance. So it's not based on what you had yesterday or last week. So somebody will come in and they'll say, well, I had my B12 tested by my general practitioner and it's fine. And that's an extracellular. That's not what's actually getting into your cell, what's getting into your organ. So I want to be very clear about nutritional testing. It's very different to get a thiamine level or a zinc level or a magnesium level that's in a serum versus in a leukocyte, which is how the SpectraCell Laboratories does their testing. So again, we're giving an average over 6 months to 9 months. I usually repeat that test at 9 months. I think letting for adjustments. So that's the first point I want to make. I think that there are, to do it nutritionally versus from a supplement depends on, for me, how many deficiencies a person has. In many, many cases, I will have somebody that has 8 to 10 different deficiencies. And so when I see something like an oleic acid deficiency, for instance, I will say to them, you know what, take some oils, put some olive oil on your food, eat more avocados, rather than saying take more omegas, because that's yet another pill they're going to have to take along with their N-acetylcysteine and their zinc and their selenium and all of that. As a general rule, I will stay away from a multivitamin. I think that a multivitamin, when somebody says, oh, I have a calcium deficiency and I have a B2 deficiency, I'm just going to take a multi. It's not possible to get all of your nutrition from a crushed pill. It becomes denatured, and you're not being able to absorb all of that. So it's very rare that I'll say, take a multivitamin. I also think something that we didn't talk about in this lecture that helps with stabilization of the telomere is probiotics. I think that's huge when it comes to telomere health, and probiotic does so many things on so many levels. I mean, if I remember to take 1 pill a day, it's going to be my probiotic. It helps neutralize acidity of the body. It helps for good gut health. I think that's my vitamin of choice. Again, we can't test that in a SpectraCell, but we do test for various acidophilus and other probiotics in a stool test. Again, people might say, oh, I'm taking it, but yet their levels of which particular element they're taking may not be the right one, may not be the right ratio. So that's an important subject to really hit on as well. What else can I answer there? Because you asked so many questions on that one, I was trying to run through it all.
Oh, that was really, we have gotten really just a ton of questions on that topic, and so thank you so much for clearing that up.
Well, Heather, can I say one thing? For people who, again, I'm sure that a lot of these listeners are familiar with the SpectraCell test, but when you ask me about, well, what diet somebody should have, the beauty of the SpectraCell as well is that you get a printed out, manual essentially that is individualized for each person with what foods they're supposed to eat depending on what deficiency they have. So it goes into really the biochemical analysis of what that particular element does, and then it goes into the symptomatic one so that the layperson can understand it, and it also then goes into what foods the person should have, and then it goes into how much of a supplement, how many milligrams or micrograms that person needs to reestablish, and for how long they need to do it until it equilibrates. So it's a wonderful thing to be able to discuss with the patient. I mean, when I get my results back, it is an office visit because although they have that manual for themselves to take home, it's always better to really go through it so that the patient can have the optimal results based on their analysis. So it's good for the doctor, it's good for the patient.
Wonderful. Thank you so much. There's a question on the variation of test results for telomere testing. Example, if someone came in and had a 74% and the next year they came in and they had a 71 or 72%, would you be alarmed at that point? At what point would you get perhaps alarmed and start looking at other tests or exploring other things?
I wouldn't be alarmed. I think that anything more than a 4% deviation needs to be looked at. And again, in my experience, what happens is people will go gung-ho the first few months and then feel better and just kind of, non-compliance. I mean, the biggest problem in medicine is non-compliance. And that happens with vitamins and hormones and things like that. So when I see that, it really is about having a dialogue with a patient and going, okay, why did you stop? And with the hormones, it'll be, oh, I read something in the paper. With the vitamins, it's, I just got tired of doing it every day. So again, even when you have that 3%, if I see a 10%, then I get alarmed, But usually, within a 4%, I'm okay. 4 to 10%, it's usually, you know what, you got to get your act back together. And at 10% is when I'll do a new complete evaluation of where are we at. I mean, obviously, with my musician, it was a gross change, and yet he felt great. He was in denial, and I was just fortunate, or he was fortunate, that I insisted on pursuing it. But he, he's okay. He's okay now. But he was a young guy. I have to say that he was a young guy, and completely asymptomatic, and we were able to make this diagnosis. So
fantastic, great. That covers most of the general questions. We have a lot of questions here trying for people wanting to find out where they can get more information. I want to mention if someone is interested in getting the telomere testing, offering it in their practice, or getting it as a consumer, you can visit www.spectracell.com. There's information on our website about the testing. There's information about finding a physician to get the testing done, and other various resources. Dr. Cwynar, we also have a lot of requests for more of your knowledge, and it's a great time to call some attention to the book, The Fatigue Solution, Increasing Your Energy in 8 Easy Steps. Dr. Cwynar did a wonderful webinar for us last month that is posted on our website, and that's available for anyone that wants to go to www.spectracell.com and get a copy of that. The slides are available. The recording of this webinar is available. And you should definitely go to www.dreva.com and find out some more information. There's a ton of resources on her website as well. Dr. Cwynar will also be doing a topic with us in September focusing on thyroidism. And we want to really just thank you, Dr. Cwynar, so much for sharing all of this information with us.
Thank you, Heather. You know what, though? Beth, who's sitting with me, mentioned that I didn't mention the choice of vitamins, so I have to just put my 2 cents in here.
Absolutely.
Then we're talking about, again, that telomere and going down. My biggest pet peeve with patients is once they know that they have a deficiency, they'll go, and I don't want to trash GNC or Costco, but they'll go to one of those stores and they'll get that kind of vitamin, and then they're surprised when they haven't improved, both physically day to day for their lifestyle, their fatigue, their energy. The raw ingredients in the vitamins are very, very key, and I hate to say you get what you pay for, but a lot of these companies will just put, trash in their tablets, in their capsules, call it something, and it's not available to the human body. So, once you do these tests, please encourage your patients to get a good quality vitamin, because you're not doing them any justice, you're not doing yourself any justice, and I think that that's one of the reasons why a lot of physicians and a lot of consumers will just, poo-poo the vitamin thing, because they're like, oh, it doesn't really do anything, it doesn't help. If you get a good quality product, you will see a huge difference in quality of life, and you will see a huge difference in that telomere. So it's not just good enough to identify the problem and get a vitamin, and that's why I say, food is always good, but you don't want to max out on that either. Raw ingredients, good quality. There's a lot of research out there on all of these companies that make the vitamins and supplemental companies. So do a little bit of research. Doctor brand is usually better because, again, when a physician puts their name to something, it's their reputation as opposed to just getting something that sits on the shelf. Shelf life is really important. So, again, these larger companies that do mass production, they have to have a longer shelf life, and that really is not good for your body. They have a lot of ingredients in there, a lot of fillers. That's another reason why I like the bioidenticals, which is a whole different conversation as well, but they're short. They go bad fast because they're raw, they're great, they're real, as opposed to getting a chemical which is meant for long-term shelf life. So please educate your patients about getting good quality, because otherwise you're not going to see any difference from all the hard work that you're doing and they're doing for optimization. So that's my last 2 cents.
That's wonderful, and I think that's a fabulous takeaway message, and thank you very much for your time and for sharing all of this information. Thank you so much again for doing another webinar with us.
It's my pleasure, and I want to thank everybody who's listening to me ramble on. I'm passionate about this. It's a great, great test, and again, it's fascinating, and I think that cutting-edge research is phenomenal in the subject of telomeres. So we're just, thank you for allowing this test to become commercially available, Heather. I mean, I think it's incredible.
Well, thank you so much. Well, thank you, everyone, for joining us. We look forward to seeing you again next month at our next webinar, and again in September with Dr. Cwynar. Good night, everyone. Have a wonderful evening.
Thank you.